Hi, welcome to my channel, Zen and Fit. I'm Nikki. I'm the creator of Zen and Fit. I don't think I normally say that. I usually just refer to Zen and Fit. But anyhow, today we're going to be discussing the differences between an MSW, aka LCSW, versus a marriage and family therapist. So I actually have a special guest that's on with me today. Her name is Sasha, and she's an associate in marriage and family therapy. So she's going to be talking about her field and what she likes about it, what she doesn't like. So if you haven't already done so, please hit the like and subscribe button to support the content on this channel. So, Miss Sasha, welcome. Thank you for being on my channel today.
Thank you for having me. I really appreciate it.
Yeah, so you're an associate in marriage and family therapy. And I
Okay.
always think it's great to show the different perspectives, the different disciplines in the field of, the mental health profession. So thank you so much for coming and being willing to share your experience, your professional experience. So tell
Absolutely.
me, what motivated you to go into marriage and family therapy?
Well, initially, I knew in high school that I wanted to do mental health, introduced to psychology. I thought it was so fascinating, especially as an individual of color. I honestly didn't even know that was something that I can do.
Hmm.
So, as I continued going through school, taking classes, became very interested, it came to a point for me to kind of figure out which track I wanted to go on.
Hmm.
And I knew I wanted to, first of all, work with children.
Okay.
And I knew that the important part of a child's welfare is working with their families.
Hmm.
So I initially wanted to do school psychology, but I felt it was going to be limiting. I wanted to make sure that I could work in an array of settings with an array of people and try to ask support within the communities as much as I possibly can. So, with more research, more time, I stumbled upon the MFT program and realized that that would have given me the type of freedom I wanted to be
Hmm.
able to move about in the field as well as allow me to have access to various groups and populations of people.
Hmm. Okay. And now that you've been working in the field, because you've been working in the field for some time now, what can you share with other people who are, considering different tracks and they want to, learn about marriage and family therapy? What can you share, like both the positives and possibly any negatives that you see within your field?
Yes. So, first and foremost, definitely be very intentional about the populations of individuals you want to work with and the purpose behind it, because each discipline is going to cater their program to have you focus on specific type of interventions, specific types of communities, things of that nature.
Mm-hmm.
So, for a marriage and family therapist, which ultimately implies that I can work with individuals, I can work with children, I can work with families, I can work with couples. That also gives me free range to work in other settings, such as like a group home setting, where I can do group therapy, things of that nature. So the marriage and family therapy discipline allows for me to have, or the individual to work with all persons, regardless of the setting. The best feature I would say about having that type of freedom is, again, you get to do and be wherever you see fit. MFTs tend to go into private practice a lot. So if you're someone who wants to be able to work with whomever you want, wherever you want, without very many limitations, MFT will definitely be a good option for that. If you are someone who is very psychology based, meaning that your primary concern is understanding the mind, how it works, and how it affects a person's interpersonal relationship, so the relationship with self and others, as well as the intrapersonal relationship, the relationship with self. And MFT is definitely going to be focused on those aspects. They understand the world around them, but they're more focused about the individual and how that individual, or if you're working with couples and families, how that system is impacting a person's self awareness, a person's sense of self value, self worth.
Hmm.
So if you're more about the individual and helping those individuals really challenge some of those internal boundaries or barriers or ideas of themselves, MFT would be a really good track to explore.
Okay. Okay. And thus far, since you've been working in the field and, you mentioned how, you can work with children, adults, and, couples, what is like the highlight in your field that makes you passionate about what you do?
The highlight, just on a personal standpoint, is being able to see the inter intrapersonal changes that an individual has, where
Mhm,
this individual learns to feel more empowered about their ability to evoke change around them for their own emotional safety,
mhm,
as well as being able to see how children can kind of develop these new skills. And then they ultimately have an advocate who can step in and support the parents to
mhm,
learn how to develop the skills so they can be more emotionally attuned to their child.
mhm,
I would say that's the best part about being able to work with all groups of people
mhm.
because you can pull everyone in who may be able to be an asset to that individual to help them with their individual growth so that those relationships can be strengthened as well.
Okay. And can you talk about, for some people who may not be familiar with like the educational path that you have to pursue in order to, become a marriage and family therapist, can you talk about that a little bit?
Absolutely. So there I've heard of, not my path, but there have been people who were able to go into the grad school track after coming from a different career. They just had to take certain like extra courses that kind of gives them a quick overview of what psychology is before they get into the actual master's degree program criterias. But
Mhm,
ultimately, the track that I ended up going is I obtained my bachelor's of arts in psychology, so at a 4 year, and then I went to a graduate program for clinical psychology. And the reason it was clinical psychology is that school just happened to take on that more clinical approach, whereas other programs, as I stated earlier, will gear you towards more of different type of specialties. So like a school psychologist, or for instance.
mhm,
So both ultimately for the individual, it's going to be at least 4 years of undergrad, preferably in the field of psychology, and then typically a 2 year master's program if you have the privilege of being able to go full time. Many people, especially if you're working, you end up doing kind of a cohort or a part time position, which can take usually about 4 years to be able to complete. So an individual can expect to go to school anywhere between 6 to 8 years for the master's level degree.
okay. And is there anything else you would like to share about your field or anything else?
I would say one of the downsides that I have come to notice as I've been working is that the rate of pay. For the type of work that we're doing, the rate of pay is not up to par with all of the education, the
Mm,
debt that tends to be accumulated, the time that has to be invested, and then, of course, the emotional toll that it takes to kind of be the bearer of all secrets for these individuals. A lot of places pay very well under what would be a reasonable means of income for a therapist, just
mm,
personal opinion. I've also noticed that the discipline of MFT, they can tend to earn almost $2,000 less than, let's say, a social worker, MSW.
mm,
I would assume it's because of the additional aspects that social workers take on, where they usually take on higher cases. Maybe they have the assumption that because I'm an MFT, I can go into private practice and pretty much charge whatever I like. I'm not really sure. I think that that's a really good conversation that maybe we should explore a little bit.
mhm.
Um, within the field to figure out why there's such a pay discrepancy and what this rate of pay is really implying. But I would say the rate of pay is the main thing, going into spaces where there's a lot of expectation for work and heavy caseloads, but the time that is expected to be invested doesn't really feel like it's paying off because it puts us in a position to be experience burnout very fast. So that would be the main con that I would have to say about the MFT program.
Hmm. And I think I can relate to that even in the social work field, because there is a lot of overlap in our fields.
Right.
And yeah, the burnout is high, and like you said, with the pay, even though, yeah, okay, there may be a paid, a little slightly higher pay among LCSWs, it's still a lot lower when you compare it to, like, people who, of course, work in the medical field, like nurses, or,
Right.
mental health tends to be overlooked a lot with the parity and compensation.
Yes.
um, I thought, like, even with healthcare reform, they were going to be addressing that somewhat with the parity and reimbursement, but it's still a lot different, even in the private realm, when you compare it to the medical field. We're still treating, we're still, providing therapeutic services to our clients. It may not be, we're not rendering medication services, of course, but it's still very valuable. And hopefully someday that will be recognized, more so on a national and international level too, for people.
I think with the pandemic, those conversations are definitely starting. I think
Hmm.
people are starting to really see the value of
Yeah.
mental health professionals, especially with this pandemic going on. So I
Hmm.
know that they're making strides in the medical field, but I assume that hopefully as time goes on and as more of us continue to shift the way we operate and they start to lose access to us in certain realms, they'll
Hmm.
start reconsidering those things. Yeah, there's definitely been a change since 2020, though.
Hmm. Yeah, that's true. And because of the shortage,
Right,
for sure.
right.
Yeah. So now that, thank you for sharing about the field of MFTs. I'm going to briefly talk a little bit about the MSW track so that people, have some awareness if they're comparing and, thinking about going into, especially if you're looking for therapy, because that's more so our focus in this discussion today. If you're looking to be like a mental health professional, be a therapist. So with the MSW track, social work is a really old profession. So with the field of social work, it is a really old profession. I believe it started in the late 1800s. One of the first schools started before 1900, if I recall correctly. And so with the field of social work, it's really broad. Like how Sasha was describing MFTs, it's really focused in psychology. With if you're looking to pursue a master's of social work degree, which is what you need to have in order to ever become like a licensed therapist and work with clients, you have to, of course, find an MSW program in your local state wherever you reside. And so with an MSW, it's very broad. A lot of our focus is can be on policy. We look at the individual, but we also look at how the systems impact a person, like at the macro levels that they like to refer to it as, on a bigger scale, as well as the kind of middle level of how certain systems impact a person's mental well-being. So that's how, like, social work differs a little bit from marriage and family therapy. We can work with of course, couples, we can work with adults, children, but our focus is not only treating that person's, let's say, their depression, but we're also looking at how systems may be affecting that person. So let's say, you have a client who's coming into you and they're depressed. They're dealing with a major depressive disorder. But some of the things that's influencing their depression may be that they're dealing with income insecurity, or maybe they were in a domestic violence situation. And so that's contributing to their depression. So, as a licensed clinical social worker, not only am I treating that person for their depression, I may be referring that person to, let's say, a domestic violence shelter, to different resources out in the community, that that person can connect to get treatment and help and support. Because we see that overall that can improve that person's overall mental well-being. So that's kind of how it differs in a way from in the field of social work. And so when you're pursuing an MSW, you can go down various tracks depending on the school that you're looking at. So some schools may have a focus in child and family welfare. They may call it something similar to that. There may be another concentration that's in mental health or healthcare, or let's say with older adults. And so, if you are specifically looking to pursue a career as a licensed therapist, and I've said this in a previous video, maybe I'll try to put the link in the description of this video if you guys ever want to check that out. But basically, if you're looking to become a mental health professional, I highly recommend for a person to go either the mental health track, or they at your school they may call it healthcare, or maybe older adults, because that'll at least have more of a clinical focus with it. So, that's one thing I would recommend if you are looking to go the MSW track. Make sure that you look at the concentrations that they offer, because let's say if you do child and family welfare, that's not really necessarily clinically based. And after graduation, sometimes it can be hard to, um, find agencies to work for, uh, if you're looking to pursue a career in the field, and trying to become licensed. So it's just a little bit easier if you do the clinical track in graduate school, because that kind of already sets you on that path. But let's say if down the road you want to change where you don't only want to work as a mental health professional, because like Sasha was saying, the burnout can be really high, and you now want to be just a children's social worker, which is different than a therapist, because a children's social worker, they're mainly just doing risk assessment for minor children. They may be working for a non-for-profit or maybe a public agency, and they're going into homes to evaluate for, child endangerment. And so it's easier to, I think, to switch paths to go along that route, going from a clinical base to, more so case management only, risk assessment, than versus going the other way around. So that's the difference. MSW, when you're going, let's say, trying to enroll into a graduate program for an MSW, it's very broad. They have various tracks. But if you have interest in mental health, I highly recommend pursuing a clinical track and talking to the advisors in the graduate program to help them. For them to help you in identifying which one of those tracks would be more so clinical based. So after you graduate, you do have to get clinical hours if you want to become licensed in whatever state that you reside in. It may be for a period of time. You may have to get, hours where you're providing group sessions, individual therapy, and so forth, and you're being supervised under a licensed professional. And that can be an LCSW. I think even marriage and family therapists can supervise associate social workers, clinical social workers. So that's pretty much the basis of the field. What I will say, just to kind of go back to what Sasha was talking about, sometimes in the field of social work, clinical social workers, I should say, sometimes they do get higher pay. And that could be based on sometimes, because clinical social workers can work in private practice, and a lot of us do. But there's also opportunities where, some clinical social workers want to work for non-for-profit, or let's say public entities. And sometimes the pay can be higher in those arenas, depending on where you reside. And so, um, with clinical social workers, they may have opportunities where they can work in healthcare, they can work as a hospital social worker, maybe more so in discharge planning, or they may be working at like a mental health agency where they're specifically providing psychotherapy services. So the one good thing I do like about the field is it's very versatile. Like if you want to, let's say switch it up and you want to work in the hospital setting, you can do that with a clinical, if you are a licensed clinical social worker. So it really gives you opportunity to pursue so many different paths. If you find yourself getting burnt out and you kind of want to change things up. So besides the benefits of it being, very open and fluid and you can do so many different things with it, the one thing I would say that I don't like about the field is that I think that there's uh, can be more advocacy for clinical social workers. I think there's a lot of advocacy for clients, of course, which is great and phenomenal, and we're here to support our clients, but we also need to advocate for ourselves more. Like some of the agencies, like let's say the National Association of Social Workers, they do a lot of advocacy for clients, which is great, but I think that there could be a greater push for the profession and for the individuals who work in the profession, especially when you're talking about the pay and other things like that, the working conditions. And I think like the NASW is starting to get to a point where they're advocating more, but I think that that could be even greater within the profession. So I hope that it kind of explains, MSWs and how to become, like, let's say, a licensed clinical social worker. And also you do want to research in your state to find out, okay, what are the guidelines? What is the path that I need to complete in order to become, let's say, if you do want to pursue and become a licensed clinical social worker. But I would like to thank Sasha for coming on here today to explain the marriage and family therapy field. I think marriage and family therapists are phenomenal, and especially because you guys are very clinically based. So, anything else you want to add, Sasha, before we conclude this video?
I mean, well, first and foremost, thank you for those accolades. I mean, this is a profession that tends to be very thankless. So it
Hmm.
is extremely important that not only as disciplines kind of get together and support one another, but interdisciplinary as well.
Yeah.
Because as Nikki mentioned, we do work hand in hand a lot of times. You will work in a center with an individual who is an MSW, an MFT. There's also the PCCs, and a lot of times there can be some type of division, but we're in the trenches together. And so it's really important for us to remember that and learn how to utilize each other's strengths as opposed to looking for opportunities to try to one up the other. Unfortunately, you can see that a lot in the field. And this kind of work is very taxing emotionally. We do not need to attribute some of that emotional damage or vicarious trauma that we can endure on one another for ego purposes. So I think just coming together, I know Nikki mentioned with social workers being advocates for themselves. If we learn how to band together, then I think we would make a lot more progress as far as obtaining advocacy for the mental health professionals so we can see those changes. So there is less burnout, there is less discrimination, there is higher pay for the amount of work we're doing. But yeah, I think that would be the main thing. But
Mhm.
absolutely, thank you so much. I really appreciate the accolades. And um, one thing I do want to say about MSW is that you guys are phenomenal at having resources because you guys are so social based. And that is one thing I wish I had more discipline in. But again, learning how to work with one another, you build upon each other's strengths. So that's one of the benefits to being able to collaborate with others.
Yes, definitely. Well, thank you, Sasha, again. And if you like this video, please hit the like and subscribe button. And if you have any questions or comments, please, put them, on this video. And if you'd like me to do more similar videos like this, or to have maybe Sasha on again if she's willing, just let me know in the comments section as well down below. Take care.
Awesome. Bye.